Hi everyone, I'm Sreelekha Giggilam and I'm here to talk about identifying anomalous COVID-19 trends and impact of different COVID-19 policies on these trends using large deviations theory. Now, before we dive into the topic, let's discuss why do we need to study anomalies or anomalous COVID trends in the first place. In most contexts, anomalies can be either the worst or the best possible outcomes because they're very often rare. And learning more about them can help us understand troubleshoot the issues, or in case, if beneficial, seek methods to reproduce these beneficial anomalies when necessary. Especially in case of epidemiological studies, one can study the policies that failed or succeeded in controlling spread of diseases like COVID. However, the epidemiological data is often large, high dimensional, and temporally evolving with too many external latent factors, which makes them very hard to study. For instance, look at the COVID 19 confirmed cases trend. As you can see, multiple policies locally and globally were implemented and relaxed that resulted in evolving trends. Due to the complexity associated with the data, analyzing them is difficult using traditional methods. In this figure, we present a temporal anomalous score in the shaded blue around the trend line in Italy. The wider the shade is, the more anomalous the trend is as compared to the global patterns. But why do we need to use a novel method instead of traditional approaches? To study temporal data like COVID data, there are multiple models like time series modeling algorithms, epidemiological models, as well as curve fitting algorithms. However, most often these algorithms cannot handle multivariate data, like in the case of time series models like RMA or SARIMA, or cannot detect evolution over the time. This is why we present our LAD model. The model is designed to capture anomalies in high dimensional data without the use of dimensionality reduction. It's based on large deviation theory and is capable of capturing change in trend across different features. The model relies on the Dawson-Gardner projective LDP principle to deduce anomalies probabilities in high dimensional data. Due to this, we can capture both the temporal and lateral dependencies within the time series database. The detailed theoretical details of the model, as well as the background on the large deviations, is omitted in the interest of time. For more details, one can refer the paper listed below. In this section, we'll look at anomalous COVID trends in US counties, across various countries globally, as well as we study the impact of different policy changes in US. The data sources are listed here. To study anomalous COVID trends in US counties, multiple settings were tested. Here we only present the results based on complete time series history versus considering only the instantaneous time step. For evaluation, total confirmed counts and death counts were collectively studied. Based on the setting, different set of anomalous counties have been identified. One particular point of interest is the counties that have been identified as anomalous in the full history setting. In particular, it can be seen that increasing trends in North Dakota counties were observed after the Sturgis motorbike rally in North Dakota during COVID. Additionally, removal of face mask mandate in Florida was followed by the spike in Miami County, which is seen in figure 3A and 3B. Similarly, most counties in New York have been pegged as anomalous during the initial stages of pandemic, which was captured in figure 3C and 3D. To study the global trends, we look at the total confirmed and death counts, daily new cases, bi-weekly growth rates, and case fatality rates collectively. The anomalous The most anomalous trends were observed for Italy, US, UK, and Mexico countries. For the sake of analysis, only countries with greater than 10 million population were considered. Of particular interest is the anomaly score for the Mexico in the late 2020. This is due to the high fatality rates as compared to the global normal as seen in the following slide. Also, the high anomaly scores for the countries in March to May 2020 is seen due to high biweekly growth rates as seen in figures 6 and 7. Even though anomaly scores are seen to change, the reason behind these increase in trends must be further studied. Thus, we look at policies implemented in different countries. Here we study the US policies implemented over time and the delayed impact they have on the COVID 19 daily confirmed counts. In particular, it can be seen that the high anomaly scores in April 2020 were followed by multiple lockdown, travel bans, testings, and face covering policies, which eventually brought down the spread as compared to the global normal. However, relaxation of the workplace closure and stay at home in early fall 2020, followed by the traveling during Thanksgiving and spring and Christmas breaks, led to increase in COVID-19 spread as seen in figure 8. Similar trends can be actually seen in death counts in figure 9 here. There are a lot of future works that are associated with the model. For instance, the measure of impact of the policy implementation as well as the delay are still to be studied. Weighted scores can be actually implemented for features as well as temporally prioritizing more recent events. Clustering similar trends and studying anomalies in multi-model datasets can also be useful. Thank you.